Dana.
Hi, I'm Dana Otis. I'm a licensed clinical social worker. I've worked in behavioral health for about 24 years, and I've worked in both direct care and administration. I'm currently the Senior Director of Behavioral Health for Lourdes Hospital, and I'm looking forward to sharing some information through this broadcast today.
Great. I'm Melanie Olson. I'm a licensed mental health counselor. I'm also a licensed substance use disorders professional. I've had about 20 years of clinical and administrative experience in the business of helping people. I've also had some time in the workforce development profession, and I'm also a Navy veteran, which I'm very proud of. And I've been with Lourdes for about 15 years. I started my career in behavioral health, working as a mental health professional in the jails, and have done a lot of outpatient work in various departments since then. And now I am one of the directors at Lourdes Counseling Center.
I'm Jamie Finch. I am a licensed clinical social worker associate. I have my master's in social work from Eastern Washington University, EWU, and I got my bachelor's at WSU Tri-Cities, so also go Cougs. Currently, I'm with Kadlec. I've only been with Kadlec for about the last 5 months, working as a behavioral health specialist. So I just returned to direct care. Before that, I was working in management for a couple intensive youth outpatient programs, the SWIFT program and the WISE program. Was helping manage both of those, and was also previously the mental health professional for the juvenile detention. And have a close relationship with the juvenile court, and have been working in behavioral health for going on the last decade or so. I think that's about the extent of it. Excited to be here today.
Great. All right, so we're going to jump into this. We're going to talk about behavioral health in the workplace, and we're also going to talk about behavioral health in families and how we can help keep people healthy. Behavioral health has had there's been a lot of impact to behavioral health because of COVID-19. And so I wanted to put out a little bit of information and let you know that there's a lot of really good information out there about what those impacts look like. But I highly recommend that you get your information from reputable sites like the CDC or the World Health Organization, because there's a lot of information out there. And it's not necessarily good information. So stick with the stuff that you know, like the CDC and the World Health Organization. And if you're interested in that kind of thing, you'll get good information from there. The Department of Health also has some real good information. What I'm going to show you here in just a minute is information that was gathered through emergency room visits. And as you know, access to the emergency department and those visits have varied widely across 2020 because of the COVID pandemic. So the data isn't perfect. And at times it can appear to be somewhat misleading. Overall, what we know is that anxiety and depression has had some fluctuations, and this is very similar to the responses that we have seen in other natural disasters like Katrina. There's been a rise of anxiety and depression. And one of the things that I found interesting in some of the statistical information that I read is that depression has been reported more frequently in men than women, and anxiety has been reported more frequently in women than men. There has been also a rise in emergency room visits for suicidal ideation, thoughts of suicide, or suicide attempts, and suspected drug overdoses. The information that I have on the screen comes from a report from the Department of Health that's available to behavioral health organizations and folks that are in the helping field. But I believe it's published and you can access it. There's a lot of charts and data in there. So what we know is that there are a lot of impacts on the workplace, not just our workflow, but also on our well-being and our ability to function on a day-to-day basis and carry out our regular routine. This pandemic has really had some impacts there. Behavioral health in the workplace, typically, you'll see it from time to time, but most common, the symptoms are not problematic and people are able to still function even if they have behavioral health issues. They can still do well professionally, they can still do well socially. But what we see is that as acuity increases, success in the world of work is impacted. There's a greater need for more support to improve the functioning. So what is behavioral health cost really in the business world? So according to the advisory board and their studies, it shows that there's an $875 average increase per member per month costs for patients with behavioral health diagnosis. And I guess that's to their insurance costs. Most patients that have behavioral health conditions also have a medical comorbidity, and the behavioral health conditions generally will go untreated. So as a business or an employer, if you're ignoring the healthcare needs or the behavioral healthcare needs of your workers, it can have devastating effects on productivity, on insurance costs, and revenue as well. Okay, come on, next. Oops. Well, I somehow managed to skip a slide and don't know how to go back. Let me figure that out.
If you, Melanie, if you try using the arrow on your keyboard, that might
help there.
That might
Okay.
work.
Let's see. Nope.
Nope.
Try that. Try that. Nope. Okay. Well, let me go to the actual slide thing. I apologize. I'm not very technologically savvy. And I keep going through. I'm going to go through the whole thing and start it over. How about that? Here we go. Okay. Okay. So people in general right now are far less tolerant and far more irritable. And you're going to see that not just in the workplace, but everywhere that you go, grocery store, what have you. I think we're just a little bit threadbare. And so things that typically wouldn't make people upset or anger them is really getting under their skin. You're probably going to see an increase in somatic complaints, like, I have headaches, stomach ache, higher rates of people having to call out sick, increase in anger, irritability, anxiousness. There's a heightened sense of job insecurity no matter what. I mean, it's even if it's not real, people are feeling like they're going to lose their jobs. Productivity may have decreased and there's a less attention to detail and an increase in errors in the workplace. And feel free to jump in, other panelists. If you have something to offer up on this one. So one of the things that we need to think about is how we are taking care of our employees. So if your company has an EAP plan, right now is a really good time to make sure and remind them of those benefits. Those benefits are really helpful. Make a list of local resources to include behavioral health, suicide crisis, self-care, those types of places that your employees can access on their own. And we've put together a pretty good list here at the end. Be real with your employees, be empathetic, and let them know that you're in it too, and that it is affecting you as well. Make sure that you're maintaining your routines. Even if they're online, if you've had weekly meetings with your staff, don't stop doing that. Even if you're working remotely, routine is going to be very, very important. Look for loss of productivity, poor work quality, and poor self-care. And if you see a change in behavior, address it, ask about it, use it as an opportunity to ask how they're feeling emotionally and extend some grace. We have to be a little bit more flexible and creative in how we are approaching folks that are not really producing at their level. We don't know what's going on behind the scenes with them, so it's important to ask. Understand that not everybody is great at working remotely. I'll tell you, my experience, I'm not very good at working remotely. I get distracted very easily. And so for me, I need to have a place where I can go that's away from my home, or I'll keep getting up and having to go check on the dogs or sort the laundry or something. So check in with your employees and see how they're doing. Asking about the challenges that they are facing, and also acknowledge that there are challenges. I know a lot of people have said, oh, wow, it must be so easy for you because now you get to work from home. But that isn't necessarily true. My husband's a school teacher, and I have had a lot of people comment that it must be great now that he doesn't have to see kids face to face. But the truth is, he's working harder and in a different manner than he's ever had to. He's been a teacher for 30 years, and he basically, like it's his first year of teaching. So working remotely isn't always everybody's first choice of how to work. So when you have people who are struggling to work remotely, try to find creative ways to maybe get them back into the office. We've had a few folks here that really were reaching out to me and saying, hey, I'm really struggling being at home. Is there a way that I can safely come back to work? And so we were able to work out alternating schedules so that traffic flow was very, very limited coming into the building. And there was a reduction in having to, be around other people and have contact. So just to have a quiet place for somebody to do their work in their office in an environment where they're not going to be interrupted meant a lot to the folks that were working here and had been home for, I think it was a few months at that point. When you're able, allow for autonomy and try to maintain, again, those general schedules and routines. And if you are talking to one of your employees and they are demonstrating or they say things that may lead you to believe that they're suicidal, you need to ask them about that. There's a really great tool, and I've put the website here about how to communicate with people who may be suicidal. Okay, come on. Administration needs support too. One of the things that you could do is create a management or leadership group that meets to discuss work and how they can support each other, and focus that meeting on the leadership issues and common problems, not necessarily the workflow or the administrative things that they would normally talk about. Check in with your leaders and remind them that they too can access EAP. Help them with low-hanging fruit. It's sometimes, like staffing can be very difficult when you're trying to hire and you have other things going on. Use local resources like WorkSource or TC Futures to help them get employees into the door and help them get trained. Things that you might not have done in the past that you do yourself. There are lots of resources out there that can help you with that. Ensure that leadership teams take their lunch hours and also take time for self-care and have good boundaries around work. Folks, I've had comments of people being very concerned about their leadership team sending them texts or emails very late at night or early in the morning and feeling like they have an obligation to be on call 24/7 and answer those emails not within regular working hours, and it can be pretty intrusive. So, remind the leadership team that they need to care for themselves too, and probably shouldn't be sending out texts and emails at 2 o'clock in the morning or midnight. Be creative and set aside some time, like 15 minutes for a fun, non-work-related activity. Make sure that everybody feels appreciated. Send out a nice email or a thank you card, or just let people know that you're grateful to have them. We did a little gratitude campaign here where we had some pretty crafty folks, and so they donated little things that they made or what have you. And when somebody needed a kudo, we would give them a little gift and we'd send out an email with a little bio about that person and tell them a little bit about what kind of work they did, because our environment's pretty big and we have varied roles here, and not everybody knows what everybody does. And so being able to share that information across the organization educated them on what we actually do and who people are. And we got a really good response from that. We did that for a few months and it turned out really nicely. So here's some resources. One of them that I really think is a good one is Building the Workplace Resilience. It gives some real practical advice on how to manage the workplace in regards to, behavioral health. There's crisis information here. There was really good information on the SHRM website. NAMI and SAMHSA are behavioral health governmental agencies, and they have really good information there too. And the CDC just had a ton of toolkits and things to address not just the workplace, but how do you work with your kids at home while they're homeschooling and so on. Okay, so I'm going to pass off to Jamie and Dana.
Melanie, thank you for that, for the overview and the work that you put in to cover all this stuff and be able to go through that. Before we jump into this, something else in terms of specifically in the workforce to consider is that your staff are going to follow your leadership. And so when they see you prioritizing your mental health and prioritizing wellness in your organization, they're going to follow that leadership. And so not only setting time aside for fun activities, but also there's some really great things that you can do in terms of simple things for managing your mental health, encouraging exercise as a team. What we know is that some of the most successful organizations in the country and around the world get really creative in how they support staff. And this is a really great time to be creative and do some of that stuff. There's really easy ways to support mental health in terms of progressive relaxation, encouraging mindfulness, even doing things like finding a good book on just overall mental health and wellness that you can do. I'm struggling for the term now, but like book clubs with your staff and going through and just making it a point when you do, if you're doing, daily or weekly huddles with your team, to build in a component of self-help and wellness and encouraging people to take the steps that they need. So,
sorry to interrupt you, but that you did bring up a really good point. One of the things that I think is really helpful is the daily check-in. We do a daily huddle. It doesn't last any more than 5 minutes. It's an opportunity for everybody to check in. You talk about things that you wouldn't normally talk about in a general meeting, just to make sure that everybody's doing well, and that they know who in leadership is available in case something happens. But you never go for more than 5 minutes. Everybody just huddles up together, and you can do it on the phone. We've done it by text, and it's been a real successful tool to continue to help people feel connected. So that's a great point.
Well, and I think it's also a great way with those huddles to look for that person that might not be doing so well, right? It's right. Really common for people in general when there's some sort of group thing, you'll get those kind of stragglers that want to hang out in the back. They like to fly under the radar and be a little more quiet, and they're only going to participate if you make them participate. The people who are like, oh, I don't want to do this group thing. But those are also the people that you can be watching out for. When you consistently see that, hey, I'm doing a huddle with these folks, and Mike over there, we never hear from Mike. Taking a moment, maybe not in the group, but to just follow up with him. Hey, Mike, just wanted to check in with you. Are you doing all right? That sort of thing really, really goes a long way for people to feel like they're supported and to feel noticed, which is really important right now.
And I think I would add as well, I think sometimes people are fearful of asking the questions. And it's really okay to reach out to people if you notice a change and how they're doing and how they're functioning, to ask the question. That it's, you don't have to just, leave it and like, oh, I hope they're okay. But even beyond that, and kind of what we're talking about today is this broader scope of mental health and COVID and what we're all dealing with. Because a lot of these huddles and that we're talking about, we're seeing people face to face and being able to cue in on maybe some things and how they're doing. There's a lot of workforces where people are not in the workplace, they're working from home. And there's some people who aren't working right now. And this is a significant impact to many people, many of us. Schools, there's a lot of students who are not in schools, and the reality that the stresses that people are experiencing through this pandemic are quite real and quite serious. We were, as a panel, talking earlier about how, at the beginning of 2020, when all of this started, people kind of rallied around each other, and it was, we're going to get through this, and we're gonna make it through this. And we thought the end was going to be closer than it really has turned out to be. And as really was predicted, by the state of Washington and the data that they were looking at, beginning of the pandemic, we, for crisis services, I can say in Benton and Franklin counties, we started seeing a bit of a decrease of the number of contacts that we were having. And again, I think people felt like we're going to rally. We know this is difficult for everybody. As the year has worn on, it has been a significant impact. People are fatigued. People are tired. And how do you juggle if you're working from home, doing your employment, doing your job, being really helping your kids if you have children at home with their education, and the children that are not in school full time, and all of these impacts, and how do we deal with that? How do we navigate through that? And we've seen as the year has progressed that those crisis contacts, people reaching out for help, are starting to increase. As we're going into 2021, those numbers are starting to increase. People are really starting to reach out and say, I'm having a hard time. I'm really struggling. And it's so important that we recognize that, and that we say, it's okay to not be okay. That, it is real. What people are experiencing, what you're experiencing is real. And we don't want to minimize it. We don't want to stuff those feelings down. We don't want to stuff what I'm experiencing down. They're very real. The question is, how do you move forward, right? How do we then take those steps moving forward? And on the slide that we have up right now, and on the impacts, it's looking at the different behavioral things that we may keep an eye out for that could be changes in somebody and how they're functioning, such as the stomach aches, headaches, if you're noticing changes in mood. And these are oftentimes what we talk about with people as far as, when pre-pandemic, if you're noticing any of these things, these are when you'd reach out. If you're noticing like your student or your partner or yourself starting to have more frequent mood changes, feeling insecure, withdrawing more than they were before. These are symptoms and signs for us to look out for, to say, do we need to do something different and seek out assistance?
A lot of times,
sorry, Jamie.
A lot of times people aren't necessarily aware that what they're experiencing is symptoms of mental health that's impacting them. One of the things that I think we've noticed a lot lately, actually, in the behavioral health field, is folks coming in, and it's the first time in their life, folks in their 40s, 50s, and beyond, who have functioned really well historically, and it will say, I've never dealt with anxiety or depression or anything like that. And for the first time, they are experiencing those things. They've never experienced extreme isolation. They've never experienced the constant fear of, am I going to have employment? And how do I juggle working and also homeschooling my child and keeping my child engaged? We see youth who have typically been very successful academically, who are falling behind in school and their grades are getting really poor. And so, someone might come in and see their primary care physician and say, yeah, I've been dealing with some stomach issues and things like that. And they don't actually recognize that their symptoms are actually an indicator of anxiety or depression symptoms. And then with that, this underlying sense of, oh, well, having a mental health diagnosis must mean that there's something wrong with me, or that I'm not the person that would go talk to a counselor, and that there's some sort of stigma around it. So again, the support from the those of you who are watching this today, you're all leaders in some capacity, and so being in a position to support people and encourage them to take care of themselves and also to take care of yourselves is a great opportunity to very easily encourage people and help them feel supported. And what we know is that folks are willing to continue to engage in really hard work if they feel supported by that.
So we have up on the screen now some of the interventions. And the first one that's identified is create a schedule and stick to it. And it talks about if your child is homeschooling, use the routine, try and stick to the same routine that you had pre-pandemic. Now I'm gonna add a caveat to that. And that is that I think with that, a lot of people there has been a lot of people who felt quite stressed over and overwhelmed by, I have to manage myself, and now I have to really manage kind of the education and the ongoing regular routine of my child who's normally in school, who may be at home. I would really stress to people that although the schedules are great and you should try and keep a schedule as much as possible and be fluid with it. If that needs to adjust, if that needs to shift, what it looks like needs to change, that's okay. Don't feel like if I don't stick to the schedule and it's not working out the way it's supposed to be, I'm failing some way or somehow. Back away from that, because then you're just adding more stress, more frustration to yourself. And so I think that it's really important to be fluid with it. What that schedule looked like pre-pandemic may look very different now. And that's okay. Figuring out a schedule that works for you, for your family, for those that you're around is what's really key and important to meet your work obligations, as well as helping out students who are in school as well. So create the schedule, stick to it, and be willing to be fluid is what I would add to that.
Right.
And give yourself grace.
Absolutely.
Remember that people are resilient. We're an incredibly resilient population, and our youth are incredibly resilient also. And when they see you give yourself grace, they're willing to give themselves grace also.
Right. One of the things I find interesting is, for the littler children, they may ask you the same questions over and over again. And honestly, that can be a little bit annoying, but typically little ones that really don't understand what's going on, because a lot of them don't really get what's going on. They just have to be home and they can't go to the store and, do the same things that they used to. They're really seeking out information and maybe don't have enough language skill to articulate exactly what they're looking for. So it's important if your child or somebody is asking you the same thing over and over again, that you ask them, what do you think the answer is? And give them an opportunity to explore what they already know about it. And then get to the point where you're able to give them the information they really feel they need. The asking of the same questions over and over is also, a show of anxiety because they're not really understanding or retaining that information. So it's helpful to engage in conversation. Even if it does get a little annoying, right?
And allow room for silence in those questions. When you ask your youth a question, and what do you think it might be, and they say I don't know, don't jump to fill in the gap. Let them sit on it. You'll find they'll say, I don't know. And then you sit there quietly, and eventually they might draw something out. And one that I've found, a question I really enjoy asking my daughter and also some of my younger clients that I meet with is, well, if you did know, what do you think that might be? Because they'll say, I don't know. Okay, well, if you did know, what do you think that might be? And I really want to engage that conversation from them. And I don't mean to be tough on them, but also I want to hold in that and draw their ideas out of them, because a lot of times what we find is that they might be scared to share their ideas, or they might not have ever taken the time to step back and really think through what their ideas are. And I promise you that another person's solution is always going to be better than my solution. So if someone is going through a challenge, whether it's a youth or an adult, if I can spend time with them and I can be silent and give them the space to think, the solutions that they come up with on their own are going to be great solutions and things for them to try, because it's their own ideas and they're more invested in those ideas. So I had someone tell me one time that the first person who speaks up in a room full of silence is the person who's most uncomfortable with the silence. Don't be that person. So I'll ask a question, and I'm willing to sit for a really long time and wait for someone else to respond in that silence, because the ideas that they bring forward are going to be brilliant.
Looks like we're coming up on our time, but wanted to share some points of how to take care of yourself. And these don't always work for everybody. Not everybody wants to get up and put makeup on and do their hair. I will tell you that there was a point in my life when I had a reduction in force. And so I had to be home. I was laid off for a couple months, and I'd never not worked, not since I was 15 years old. And I was walking through Winco in my sweats at 10 o'clock in the morning on like a Wednesday or something. And I walked out to my car and burst into tears because I hadn't been taking good care of myself, and I hadn't showered that day. I didn't fix my hair, those routines that were important to me. And I realized that I had to do something to make myself feel better. So I went home and I got ready for, I don't know where I was going, but I got ready like I was getting ready to go to work. And it made me feel so much better about myself. Try to keep to some sort of routine, get up and move. I mean, even if it's just a stretch, try and get some sleep, treat yourself to something you really like, and recognize when you are feeling badly, and give yourself some grace, and seek help when you're overwhelmed, whatever that help looks like. We have a lot of really good resources to share. There's good information, and there are toolkits. I believe they're on the CDC website, and these are documents that are linked right to that. And they give you really good practical advice on how to contend with some of the symptoms we might be seeing in our homes, with our youth, with our loved ones, and with our elderly folks, our parents that are isolated, might be in a facility where you can't visit them, or you can't be connected. So there are lots of crisis support lines and self-care information. There's the one piece of advice I can give you is if something is really concerning to you, you can call 911, you can call crisis services, and or any of these helplines. I believe.
The other thing I would add also is, there are a lot of really great apps available as well that help with guided meditation, relaxation, preparing for sleep, because sleep hygiene is really important. And, those are available. They can help kind of walk you through some of the mindfulness. Calm is a really great app that helps with doing that. So, those types of things those tools are available as well.
Yeah.
All right. Thank you guys for all that information. It was fantastic. And I feel like we could probably talk about this all day. One question is, once we end, today, what is one thing people can do immediately? What is one step they can take to improve their overall wellness based on the information you guys covered?
One
Well,
thing.
I would say one thing is, what we've been talking about is self-care is so highly important. And so if you haven't already, take some time to figure out one thing that you can do each day, each week, that is really to take care of yourself. Schedule it in, plan it. If it's taking a walk, if it's stretching every day, if it's, just getting some fresh air, whatever it is that helps to rejuvenate you, to help you to kind of decompress and help with that stress relief. Plan that and do that self-care. That's going to help you with then, helping the other ones who are in your life, who are in your family. It's really important that we're being conscientious of ourselves and our own care. So think about what that thing is. Maybe try different things. Maybe try different tools that you kind of find and experiment with until you find what works best for you.
I would say stay connected as well. Relationships are so important. If there's a way for you to just reach out to somebody, and it can be just a simple text, somebody that is important to you, maybe you haven't been able to see or contact, just send out a message that says, hey, how's it going? Staying connected is critical. And
I would add also to stay connected and be conscientious of social media. There's so much information. There's so many things happening in our world today, and it can be really easy to sit in front of the screens and watch and become more and more overwhelmed. So no, you don't. I would recommend taking breaks if that is kind of who you are. You tend to watch the information and you feel like you need to stay on top of it, but make sure you're taking breaks and walking away from it, because that in itself can be extremely overwhelming.
Mm-hmm.
Yeah, that was going to be the point that I was going to make, is to, take time to tune out of the media and social media and take time to tune into yourself. And you can do simple things. Set a reminder on your phone to stop and breathe, even just 2 minutes of stopping and taking deep breaths. Just breathe in through your nose, hold that, breathe out through your mouth. Do that for 2 minutes. That's going to just calm your mind and your body down. Doing things like really honing in on good sleep hygiene, and starting to shut your mind off so you can get to bed at a reasonable time and get good sleep. And I know we always talk about the importance of eating healthy and exercise, but in a time when we're isolated from everything else and we're under extreme stress and anxiety, those things become even more important, because those things are going to keep your mind and your body healthy. And then, the resources that have been provided, I love progressive relaxation techniques. I'll notice that I'm just going and going and going, and I get stressed and I feel it in my shoulders and my neck. And you can go on YouTube and look up progressive relaxation and find a script that's 5 minutes that just walks you through deep breathing, relaxing your body, relaxing your mind, and hitting reset for a moment. It doesn't have to be something that takes an hour or that you got to spend a bunch of money on and do a lot of things. You can start your day, finish your day, find times throughout your day for 5 minutes to just breathe. And again, show yourself some grace.
Thank you. And another question that came in is, this person is wondering if you guys have seen people who are working from home, like many of us are right now, if they are developing any sort of phobia to going out in public. And I guess if so, what is a possible solution to that?
I don't know if I would consider it like a phobia, like a clinical phobia, right? I do think that some people are, because of the deluge of information that's out there and some of it's not correct, people are afraid, and rightfully so. Nobody wants to spread a disease and kill anybody. But I think folks can develop like habits of not going out because they haven't gone out, and you just need to break up the routine a little bit and expose yourself a little at a time, right? So instead of going out into public, maybe get in your car and take a drive, especially on a beautiful day. I mean, today we have sunshine for the first time in I don't know how long, and I'm highly encouraging you to get some vitamin D. Go outside today if you can and walk for 5 or 10 minutes. You will not believe how much that's going to make you feel better. So sometimes just not getting out and kind of you create your own bad habit, you know, so uncreate it. Get rid of it, you know, challenge yourself, stretch yourself to do something. And if it becomes impairing, like I'm not going to go out, I'm absolutely not going to do anything, I'm going to have my groceries delivered, and it becomes an interference with being able to get daily activities done, that's when we need to have somebody seek out help.
Yeah.
Right.
Yeah, I actually emphasize to the clients that I see that I am comfortable meeting with them in person, and as long as we're doing that safely, because I think that there is still a change in scenery is good. And sometimes you can find yourself, you know, you're sitting in your house and, you know, well, I'm working from home. I don't, you know, need to, I don't need to get ready for the day. And then you notice, oh, well, I've worn the same pair of sweatpants for the last week. And, you know, I don't ever I'm on Zoom meetings all day, but I just don't turn on my camera, and you stop taking care of yourself. And, you know, there's this idea that things happen gradually then suddenly, right? That just slowly over time, these habits start to build in, and then suddenly one day you realize, I'm not in a very good place right now. And so finding a way to change your scenery a little bit, you know, even if it's, you know, if you're not comfortable, maybe immune compromised or something like that, change what room you're working out of, you know, anything you can do to get creative and to break up the monotony. And then you just can't overemphasize the importance of human connection. So if you can't connect in person, find a way to FaceTime a friend. If you don't have, you know, Apple products and you can't FaceTime, well, turns out Facebook has a FaceTime feature, you know. Find a way, get creative to connect with other people. Call someone that's been on your mind. Do something to connect with another human.
All right, thank you guys for that information. Again, it's fascinating to me, and so I'm sure a lot of people so far, based on the comments, are really appreciating it. That was all the questions we had come in, so I believe we can go ahead and wrap up. So again, thank you to our speakers today, Melanie, Dana, and Jamie, and your respective organizations for helping with this. And again, we all really appreciate it. Thank you to SDCU for partnering with us. For everyone asking about the content that we covered today, that you guys covered today, this will be on Facebook later, a recording of it. And we have some comments coming in about the slides. So I will work with you guys on getting those, that we can push that out to the viewers today. So again, thank you for your guys' time. It was a great presentation.
Thank you for the opportunity. Very much
Thank you.
appreciate it. Thank you.
All right. Thank you, everyone. Have a great day.